And action! Sylvia had a nice question about clearing of the throat. And in her case, we treated a bacterial infection, probably throat or throat and sinus together, about a month ago. Anytime you have persistent symptoms for a month, the highest chance is that it's not just allergies, but an infection, especially if the symptoms span from one season to the next season. Usually if you don't have allergies or you don't have allergies this time of year, it's unusual to have persistence of cough, stuffy nose. In this case, where she got better with the first set of antibiotics, but still has clearing of the throat that doesn't usually hit this time of year, I have to assume that the bacteria, or whatever bacteria that lived through the first set of antibiotics, is super strong. So that's always a possibility for persistent symptoms, is either resistant bacteria that's now causing different symptoms, or just an allergy, but we've spanned across two different allergy seasons. So it's unusual for somebody to go into allergy season, maybe with postnasal drip, congestion, clearing of the throat, and then span into the next allergy season with the same symptoms. Most people are just allergic in one season or another. So winter, it's usually mold. Springtime now, you can't see it's raining outside. So in about 2 more days, it's gonna blossom with weeds and allergens. So it's unusual to go from one season to the next season. So in Sylvia's case, I treated that bacterial infection of the sinuses, congestion, the fact that she had ear popping, and see my video on DrRic tutorial stuffy nose to see how I take care of that, but we're still having problems even with nasal saline rinsing. So my suggestion is, if we kind of look at what causes that need to go and have a little bit of a hoarse voice, then you'll come up with a treatment plan, and it can all be conservative. Whether it's using butter burr, which is an anti-inflammatory that seems to have an attraction to clearing the throat, the nose, or using a nasal spray. I like nasal crom, which is over the counter, nadocromyl sodium. Or for more stubborn nasal problems, I'll do Atrovent, which is ipratropium bromide. That's prescription. The nasal crom is over the counter. Butter burr is over the counter as well. 75 milligrams twice a day. And the nasal spray, whether it's nasal crom or Atrovent, usually it's 3 times a day, chasing the nasal saline rinse, just like my video shows. Or sometimes you can actually use eucalyptus, but the problem with eucalyptus, especially if you spread it here, is that it burns the eyes. You can always do eucalyptus in your bath, eucalyptus in a steam cave. That's when you boil water. Be very careful with this. Boil water, put some eucalyptus in there, get a towel, and start inhaling. Maybe closing your eyes or rinsing the eyes if the eucalyptus is too strong. Those things usually help. Lozenges, also mentholated lozenges will always help. Whether it's Ricola or standard stuff, it always helps to give you that persistent mentholated flavor and effect of clearing the nose out. Eucalyptus or menthol work to decrease swelling, mostly in the nose. So if you have the need for clearing the throat and it's because of postnasal drip, you got it. If you have the need for clearing the throat and it's because of an upper respiratory tract infection, that means there's bacteria getting pushed up and lining the throat till you hawk it out. Then you got to treat the upper respiratory tract infection. If you have the need for clearing the throat, it's from the stomach. The stomach can also cause reflux, especially if you're clearing the throat more at night or after big meals. That might indicate you have reflux. If you have reflux, then you turn off the acid, get on a restrictive diet, or just turn down the acid temporarily with Pepcid or omeprazole over the counter. Sometimes it does require further investigation, like looking for H. pylori infections, but those are the typical reasons for the need for clearing of the throat. Postnasal drip, stuff creeping up from the lungs or stuff coming from the stomach. Now, if you have persistent hoarseness and you're a singer or a teacher, you might have to have an ENT visit or an ear, nose, and throat guy to put a scope down your nose and look at the vocal cords. Well, actually, they'll go this way to look at the vocal cords. The old way is they pulled the tongue out, got an indirect mirror, and kind of watched your vocal cords as you went through A, E, I, O, U. But the scope is more important. Plus the scope that they use for seeing the vocal cords, you actually have to pass through the nose first. So you can look at issues with the nose. It's done in the office. I don't think it's a pleasant test, but you can get by. I think they spray you with a numbing medicine so you don't really feel it. But just to have somebody come at you with a scope, I mean, it's intimidating. But again, it helps to figure out the next step. If you have a polyp on the vocal cords, or if you have cancer or a tumor on the vocal cords, that will cause the vocal cords to not vibrate properly. And when they don't vibrate properly because they got a big nodule on them, you'll have a voice that sounds hoarse or broken. That's a little bit different than having to go so I think that kind of clearing of the throat is because something is lining your throat and it wants to get out, versus persistent hoarse voice or a sore throat. So Sylvia, good question. Those are the reasons. Hopefully what we did this time will knock out the reason for your having to clear the throat out, and then we can get into spring and summer without any problems.